this episode will come out after today, which we're filming today, which is Star Wars Day. May the 4th be with you.
Oh,
Yes.
Yeah.
And
We have multiple videos coming out today. We have 3.
Oh,
3 TikToks.
3, yes, videos for social media for Star Wars Day. So the first one has been posted.
Yes. So if you're listening to this after the fact, you should still go to our TikTok. What is our handle?
It is,
I think it's at nw.health.
yeah, and you guys, if you're listening to this, go leave a comment of like a star or something so we know.
That is not what Star Wars is, but okay.
No, but like a comment so we know that like you listened on the podcast, so we know you came from the podcast.
That'll work.
Okay.
Yeah.
Our handle is nw.health.
Okay. On TikTok.
On the
And
TikTok.
Instagram too. Go give us a follow.
Please.
We post funny content and serious content.
Mm-hmm.
serious content?
We do 50-50.
Yeah.
Sometimes it's like a 75-25.
Okay.
Mm-hmm.
And I'll let you guess which way that
90-10.
swings.
95.5.
Yeah.
Well, today is our first official episode of the pod presented by Northwest Health Services. I'm Corey, lead of marketing here. Tyson's already breaking stuff.
Oh my god.
It's okay. While he's getting that plugged in, I'll introduce Tanner over here.
Hello, everyone. I am Tanner.
This is Tanner Kerns. Tanner is our creative marketing outreach coordinator. We also have Tyson Huff-Garza, who cannot seem to figure out what's going on. You need some help.
Yeah, mentally.
Back to the introductions. We
Yes.
have Tyson Huff-Garza.
Hello.
Tyson is a regional center administrator
That is correct.
for the Family Medicine Associates Medical Clinic and our training program.
10-4.
10-4. And then today, our special guest, technically, she works here, but she is our guest, is Dr. Miranda Phillips, technically, right?
Yes.
Correct, yeah.
I
You
love
have
that.
that degree.
I
Use
do.
it.
Yeah.
And Miranda
All right,
is
thanks,
our
Tanner.
director of pharmacy. She oversees everything that has to do with a pharmacy at Northwest Health. So, yeah, welcome.
Mhm.
You're
Thanks.
our first official guest.
All right, cool. Well, I'm glad
So-
to be the first.
We have a
Yay.
gift for you, but
Oh.
it's not ready.
Okay.
But we'll get it to you.
Okay, cool. I'll be
Because
waiting.
all of our guests will get a gift.
Okay.
That's
Except
weird.
Tyson.
That's
Tyson's
weird.
not a guest.
Aw.
I was on the first one, but I guess.
He kind of just is
No
part-time in marketing now.
Yeah.
Okay.
Yeah, that's
We,
true.
we just kind of recruited him a little bit
I see.
secretly. But it's okay because Tyson did marketing in some previous jobs that he was at. So he understands our world pretty good.
Absolutely.
So anyway, today we're talking about pharmacy. But before we kind of dive in, Miranda, could you just give us a quick introduction of not who you are, because I just said your name and all that, but how you got started in the pharmacy world and how you ended up here at Northwest?
Sure. So, all the way back in high school, I was kind of trying to decide what I wanted to do. Wanted to go the healthcare route. Wasn't necessarily sure that I liked the, blood right up in there, all that kind of hospital settings
Did
at
you see
certain
Tanner's
times.
face?
Yeah.
Wait.
So,
I'm going to have to, we're going to have to cut to that.
Okay.
I missed it. I was totally.
Dude, I don't know
I
where
didn't
that
even
face-
realize I did anything.
I don't know where that face came
Yeah.
from. She
I
said
he
blood and you were like,
understands. Yeah, he
I can't do
understands.
it. Well, I mean, anyway, I can do a
Sorry.
finger
I've
stick.
gotten better, but
Yeah.
especially then, I was like, no, I don't want to
not
deal
for
with
me.
that.
I get it. I couldn't
So-
do that either.
Yeah, started looking for other things. I did want to do healthcare though, so pharmacy came up. My mom actually suggested it. So I went and did kind of a thing through school, through Stevenson's Pharmacy. Went and did some job shadowing, some other places. Went once to Bender's, and so I decided I wanted to go that route. My senior year, I applied for the UMKC provisional program, which basically what that is, you get in the pharmacy school kind of right away. It's your fastest track to be able to get done. And I was accepted to that program. So once I graduated, I started my first year at UMKC, finished the 6 years there. That whole time I had been working at Walmart Pharmacy. Before that, I did about 2 years at CVS Pharmacy and then just moved on to Walmart because I knew some of the people there and just closer to home and things. So I went to Walmart to work. When I graduated, they did have a job opening in St. Joe. So it was kind of a split job between North and South Belt Walmart. Worked there for quite a while as a pharmacist since 2010. And then saw this job come up and decided I wanted to do more than just staff pharmacist, kind of do more than just the retail world. So applied for it and been here since October 2018. So
Yeah, so has it been 5 years yet? It'll be 5 years this October.
yeah,
I remember that because I was already working here.
right.
And at the time, we had one pharmacy.
Yes.
It
we
was
just
our
had
Hamilton pharmacy.
Mm-hmm.
And that was the reason they hired you, I believe, was because we knew we were going to be expanding pharmacy locations.
Correct. Yeah.
So you've actually opened how many pharmacies now?
4.
4.
Yeah.
Look at you.
That's a lot. That's a lot
Yeah.
to take on.
Miranda has
Yeah.
put in a lot of work the last 4.5 years. I've seen all of it because I've been part of it, of course. But yeah, each one is not easy whatsoever.
No, it's definitely a lot of work.
And you guys have to jump through what seemed to me like a lot of extra hoops with inspections.
Mm-hmm.
Like every time we went somewhere to start a new pharmacy, it was like, what's Miranda's plan going to be first? Because everything kind of follows suit to that, it seems
Right.
like.
Right.
But yeah, hats off to you because,
She's killing it.
yeah, she's killing it. We have 5 pharmacies now total.
That's so cool.
I appreciate it. Yeah.
Yeah.
It was the first year was a lot because 3 of them came in that first year after I was
Yeah.
hired in 2019.
What was the first one we did?
Gower.
Gower.
Yep. And then it was Family Medicine Pharmacy. And then we did North End. And then it's been Chillicothe since then.
That's right.
So
Yeah, and all of them are open now. Chillicothe's open, the pharmacy out there. We'll have more info about the medical side this summer, but the Chillicothe pharmacy's open. They have a full drive-through, and they
Love
have
a drive-through.
Yeah, I think it's the only drive-through pharmacy in Chillicothe.
okay. Yeah.
So-
I think you're right.
I'm pretty sure.
And we added one to the Hamilton location too.
Yeah,
Not too long ago,
a
and
drive-through.
patients have really liked that. They
Yeah.
use that a lot. So.
We got it repaved.
That's good.
You can actually drive around it now. When they first did it, they put
Gravel,
gravel in. So then like you would drive around, but it started drifting off
especially after
from like
the winter.
rain and the snow and stuff. And so anyway,
What was the concept behind the gravel?
I'm not going to go into
Cost savings?
detail.
It's a cheap option.
I got it.
No, I mean, well, that's part of it. The other part of it is just the person that organized all that. I don't think really.
It wasn't Miranda.
It was not Miranda. Let's just say that Miranda is pretty detailed.
They had
on
a
things.
fond liking for gravel.
I guess so.
And
They
saving
really
money,
like gravel.
I think, and saving money. So
Yeah.
you know,
Yeah.
which
Yeah,
I
that
get.
was part of it.
I get, but
Cutting
when,
costs.
Yeah.
when you know you're gonna have to redo it in a year.
Sometimes that's not always the best.
No.
But it's now concrete, so
Beautiful.
very nice paved with concrete drive-through in Hamilton.
So all of our locations except FMA have a drive-through.
Right?
Yes.
that right?
Yeah.
Yeah.
Is North
Yeah, I
End
never
Except
thought
for
of that.
FMA.
Yeah, North End
Because
has
North
one.
End now has a drive-through because we
Correct.
moved the North End pharmacy from the old location this
It was
last
over a year
January.
ago.
Yeah. Just a little over a year.
Yeah, a year and a half ago or so. And that's over there in the old U.S. Bank building
Right.
off St. Joe Avenue. I've heard that they're pretty busy.
Yeah, they've definitely. We thought maybe that area would get them a little more business, and it has. They've
Yeah.
picked up, so it's been a good thing, definitely.
What do you think? I mean, people listening and watching this probably don't know the difference between our pharmacies and some other maybe like more corporate style pharmacies. What are the differences and what are the proper terms? I don't even know if I'm saying it right, but because I know there's retail pharmacy and there's something else.
So we are a retail open door pharmacy. So we are
Okay.
still considered retail, and we see all patients. So I know some people think that since the Northwest name's on it, that we only see Northwest Health patients, which isn't true. You can go to any provider and come to our pharmacies and use them. So we are open door retail. But the thing that kind of makes us different is, we really try to work with our patients on cost. They get to know them more so. Whereas, corporate, there's a lot of people, I see once or couldn't tell you their name. And I feel like our staff really works to develop a relationship with those patients.
Yeah.
That way they want to keep coming back. And then, of course, there's the 340B program that if you see one of our Northwest providers, that really helps patients. And we really try to work with them, trying to see if they have insurance, maybe that may be the best route. But if it's a really high copay, high deductible, or they don't have insurance, 340B really helps them out.
Yeah, and that's something I definitely want to talk about today is 340B. And can you do your best to explain what 340B is? Because I've worked here almost 7 years. I still don't know how to explain to people what 340B is. When they ask me, I'm complex. Like, it's some kind of federal program.
You should come to our training. She does a great training during orientation.
Oh, you do trainings for it?
Yeah.
Oh my gosh, I need to sit in on that.
Yeah.
Well, here's the thing, Tyson. I've heard the spiel like 20 times. Mm-hmm. I still don't.
Okay, well.
And it doesn't help. It keeps changing.
I'll add you to the schedule next orientation.
Yes. Put it on his calendar.
Corey needs to go through all of our trainings again.
Kind of like this podcast was on my calendar.
Mm-hmm.
Hey, we added it.
It was on the mental calendar.
Oh, okay.
It was on my calendar.
Not on mine.
Oh.
Thank God I stopped by.
Tyson just saw us sitting in here and was like, oh, I should go sit down. That's not what happened. We found him this morning and said, don't forget we're shooting a podcast today. Mm-hmm. And he just kind of gave us that blank stare, and I was like, great.
Yeah. Remember, you're part of it. You got it. Well, you came, so that's what matters.
Yeah, he came, which we appreciate. Anyway, back to 340B. Yes. So you can do your best general explanation.
Sure. So 340B is a federal program. It makes certain drug manufacturers give certain entities that qualify cheaper medications. The reasoning behind this originally was to help out the entity. Someone like us, when you are federally funded and have scarce funds, having to always look for money or grants, this program can really help out. So it's meant to help the entity, the fact that they can get cheaper drugs, that helps them save money in other areas rather than having to spend it on medications. And this could be in the clinic. We have contract pharmacies at our in-house pharmacies. It really helps to give us significantly cheaper drugs. So 340B was created for that reason. And basically with drug manufacturers, if their drug is going to be covered by Medicaid, then they have to offer a 340B price. So that helps out, with most drugs. Medicaid is, they want Medicaid coverage. So with most drugs, you can find a 340B price, and it's significantly cheaper. Now, the way it helps patients, though, like I said, uninsured patients, we have a 340B cash program, and that can help them tremendously. We pass those savings on to the patient so that they're not paying huge amounts either. When they're having insulin copays of $100, $200 on their insurance, and we can do it on 340B for maybe $15 to $20, that really helps patients out.
Yeah.
So uninsured patients, and it helps us get some more people to the clinics too, because of course we can only do it with our providers, our Northwest providers. So if we see somebody come in, they're struggling, they can't afford their medications, we can't do 340B because it's an outside doctor, we just kind of give a suggestion of, hey, I don't know where you're getting your care or, what you think about that, but we could potentially help you with this program. You just would need to get established with one of our providers. So it's kind of it helps feed the medical side as well as the pharmacy side. Or patients that are looking to get established, we always use 340B as a reason to help get them established at a Northwest clinic.
Mm-hmm. Yeah.
So, and we even do, like I said, patients with insurance, we still check the 340B price because if it's a really high copay on their insurance, we know we can get it cheaper for them on 340B cash.
Yeah.
So we'll give them that option.
And that's, I think that's what sets our pharmacies apart from others is that they do always strive to look for the cheapest price for the patient. I'm a patient here, and anytime I need to go get a medication, they always tell me which option's cheaper, usually, if my insurance or 340B or whatever. So
I kind of experienced that whenever I first started because I went from no insurance because I had my own business to waiting for insurance to kick in here. And at retail, it was significantly higher, for the two meds that I'm on. But here it was like $10, I think, or 15 a piece. It was great. So.
Yeah.
Yeah.
We definitely try to pass that savings on to the patients because, I mean, if they can't take their medications, it's going to affect their health. It's going to cause all kinds of problems. So we want to make sure that they can continue to take their medications.
Yeah.
Absolutely. We love a discounted medication.
Yeah.
Thanks, 340B.
Tanner, he works with me in marketing, but he's also a pharmacy tech. He has his license from his previous employer where he worked. That didn't get his license from there, but has renewed his license.
Yes, I still am a licensed pharmacy technician. I don't know. I did pharmacy. I never did retail pharmacy, but pharmacy world is a world I love. So I
understand it.
Yes. I try to understand it the best I can.
Yeah.
But yeah. So.
Right.
Well, 340B has always been the biggest talking point anytime I'm at an outreach event or in a community meeting somewhere. It's always been the biggest thing that's helped people that come to our clinics. And most of the time is the thing that keeps people coming back too, because medications, it's like the most expensive thing in primary care, probably. I mean, is that wrong to say?
No, they're not cheap. I mean, you look at our inventories and things we have to buy, and when you tell patients, a box of this one medication, this injection cost over $1,000, that adds up quickly. So
I know when I first started working here, we had a patient that I met at an event. They were paying like $800 a month for insulin. And then we got them switched over to the Hamilton pharmacy, and it went down to like $70 a month, and they just couldn't believe it.
Yeah.
And that was the first time I had heard it actually working for somebody, and I was like, what? What is this 340B thing?
Yeah.
We recently had somebody at one of the pharmacies. She was getting a medication. It was a growth hormone. So expensive, cash price. She was part of the manufacturer's program. Well, that manufacturer stopped their program, so she was no longer able to get the medications free, and unfortunately, she didn't have a lot of route. So she called one of our pharmacies, was able to get established with one of our providers, whereas it was going to cost her over $1,000 a month. We were able to give it to her for around $25.
Wow.
That's wild.
That's awesome.
That's like a mortgage payment.
Yeah.
I don't have
Yeah.
a mortgage, but like that's or rent or something. Like that's huge.
But yeah, I mean, it wasn't going to be doable. And when it's something like a growth hormone, I mean, she needed it.
Yeah.
So
Yeah, some of these people have to be on these medications.
Yeah.
And if you're going to pay $1,000 a month, a lot of people can't afford that. I'd say probably most people can't afford that.
Someone's paycheck or half
Yeah.
or all or,
Or
And
more.
I've talked to people over the years that they say that. They're like, I have to choose between taking care of myself and buying my medication or paying my bills and taking care of my kids. I'm like, that would be a really hard spot to be in.
Yeah.
right.
And I mean, thankfully I'm not in that predicament yet. But hopefully never will be, but I just couldn't imagine.
You never know.
Yeah, the 340B helps a lot of people. There was another question that I thought of and I forgot about.
Well, I have a question. So sometimes when I'm talking to people out in the community or friends and they're like, oh, my medication is like, it's pretty expensive. And I'm like, well, what pharmacy do you go to? And they'll tell me, can you tell us, because I'll tell them, you should go to a 340B pharmacy. And they're like, what is that? And then I kind of explain it. Could you tell us what some pharmacies are not 340B? Like here in local St. Joseph or, surrounding
or
areas?
who offers it in this area?
Like, let's say they can't see a Northwest provider because of an insurance reason or something. Are there other 340B options?
So for ours, it has to be a Northwest provider, but there are other 340B entities such as a Mosaic in town. So if they see a Mosaic doctor, then they have their own contract pharmacies that you can fill it at that I'm sure would be better priced for them. Things have been complicated in the last couple of years, unfortunately, with the 340B program. Drug manufacturers do not like the fact that they're having to give PBMs, which are insurance companies, a discount, and then also give a discount to the entity with 340B. So basically, there's been a lawsuit for about 2.5 years now of drug manufacturers, a number of them, saying that we're not going to give our drugs at 340B price to contract pharmacies. So they want you to either have your own in-house pharmacy, kind of like we do, or they want you to report specific data to them before they're going to give the contract price. And this specific data, unfortunately, a lot of places are seeing it as they're going to try to reduce our reimbursement. They want to see the cost. They want to see how much we're actually getting paid, buying this for. And so that way they can reduce our reimbursement, unfortunately. So this has been tied up in the courts for about 2.5 years. Mm-hmm. So the problem is those drug manufacturers of certain drugs, they can't be at contract pharmacies anymore unless we're reporting that data. So that's kind of a back-end deal, and unfortunately, a lot of drugs at our contract pharmacies have had to be blocked for that reason because there's not a 340B price available anymore. So we are working on trying to figure that out, but numerous drug manufacturers now have basically said you have to do it out of your in-house pharmacies. There's just no option. So with our program, not always, but with certain drugs, it'll have to be at our in-house pharmacy that they get a decent price. But other contract pharmacies, you kind of decide by volume of patients if a pharmacy should be contracted because you want it to be a benefit to both. You want it to be a benefit to the pharmacy and the entity. So if there's not enough volume, then you decide not to contract. Now, most of the pharmacies in St. Joe, we are contracted with. It just depends on if they have a cash price with their program. So, Rogers here, Savannah, the drugstore, Walmart and CVS are part of the program, and Walgreens, but they don't have a cash program.
Right.
So that gets kind of confusing to people. So sometimes when you're needing that cheaper price or uninsured, those might not be the best option. Our other pharmacies, like I said, Rogers, the drugstore, Savannah Medical, Cameron, we have them too.
There's a bunch of them.
Yeah.
And it is listed on our website too.
Yeah.
And we can link that when we release this episode somewhere, but there's several.
Mm-hmm.
And not just
Good
in St. Joe either.
Mm-hmm.
I mean, kind of all over. So some people might not understand the whole concept of the contracted pharmacy thing. So to kind of simplify it, it basically means that if you're a patient at Northwest Health at one of our clinics, but you want to stick with like a pharmacy like Rogers where you were already getting medication,
Right.
you can still get 340B over there through our provider.
Right. It's just kind of like a contracted agreement.
Yeah.
The pharmacy is housing the entity's cheaper drugs, and they'll do the part of filling it and dispensing it and getting it to the patient.
Right.
That way you don't have to necessarily use one of our pharmacies. If somewhere's closer, they can still use their pharmacy they've been going to as long as they're a contracted provider with us.
Right.
So.
And 340B, I was going to say, I'm sure the pharmaceutical companies are like not big fans of it probably because I understand, it's a big money game, but it helps people. So
Right.
it's,
Yeah.
it's.
And unfortunately, I feel like the biggest problem are the PBMs, the insurers. Because, the drug manufacturers, they make a certain drug, they put all this money and effort and research into a drug. So they're having to give a discount twice on their product, whereas they really were only supposed to be giving, necessarily one.
Oh.
So when the PBMs are asking for these huge rebates and they're having to give all this amount off, it's a problem. And it's the PBMs and the insurers that are trying to find ways to cut reimbursement in the pharmacies. That's been a huge problem with pharmacies for a little while now. A lot of independent pharmacies can't make it anymore because PBMs and insurers, they're not even paying you back what you paid for the drug sometimes.
Right.
And you're getting a dispensing fee of maybe a penny on some drugs. It's pretty bad.
Wow.
So I'm not disagreeing that, drug manufacturers are fairly big entities and can take hits, but I feel like
there's two
the biggest
sides.
problem is the PBMs and the insurers right now.
That makes sense. So how come like our in-house pharmacies, you said in-house, why is it better for us? I guess.
So we can still do any of the drug manufacturers because there's legislation in place that gives certain specific rules that you can't restrict the drugs to the entity. Since the pharmacy is owned and operated by the entity, they can't restrict those.
Oh, I
Whereas
gotcha.
contract pharmacies, there was never any specific rules set in place.
Gotcha.
Unfortunately, HRSA didn't lay those out in any hard and fast rules, and drug manufacturers and lawyers figured that out and kind of found a back way
Yeah.
to be able to block contract pharmacies. So that is the reason our in-house can still get it, because you can't restrict the entity by law.
Gotcha. Gosh, there's so many many moving parts to the 340B program. And most people probably don't need to know all the back info, but it is nice to just talk about it, because every now and then I do have somebody that keeps asking me questions about it, and I'm like, I'm really sorry, but
You can always send them to me.
I
That's fine.
do. I'm like, you're welcome to talk to Miranda if you want, and then they just kind of
Yeah.
Like I
But-
said, I'll add you to the next training.
Yes.
You're gonna know
I mean, I
all
just
the
got
things.
it.
Oh yeah, you did just get it.
Yeah, you got more in depth, I think.
Yeah, that's
oh,
true.
we love that.
yeah. But I mean,
Will he remember?
He can rewatch this
know-
podcast.
That's a good idea.
yeah, I can rewatch this. I mean, I always know what 340B is and like what it does. It's just people want to know the how and the why. Like, because to the everyday consumer, they're like, I just don't get how you can give me this medication for $500 cheaper.
Mm-hmm.
Or
it's just-
magic.
yeah, we just
And I mean,
Clap our
a lot of the
hands.
contract pharmacies, the staff working for them, can't answer a lot of questions either, because a lot of that stuff's on the back end.
yeah.
Like when you're at Walmart, Walgreens, CVS, you don't see any of that. You don't know. It's kind of running in the background.
Yeah.
So they can't really help with those questions either. So it gets hard for patients sometimes.
I always tell people, and I could be wrong, that it's a federal program and the funding's coming from the federal government somehow. Is that
Yeah.
wrong?
Well, kind of. They're just made. They're kind of just basically making rules that you have to give the entity drugs cheaper.
Oh, okay.
So it's not really them necessarily paying
So
for
whose
anything.
pocket is it technically coming out of?
So the insurance, the PBMs.
Okay, so that's why they're upset.
Uh-huh.
Yeah.
So they don't know the 340B prices, or they're not supposed to, what it cost us
Gotcha.
to get it. They're trying to do that digging and figure it out now.
I
but
gotcha.
So basically when they're doing their reimbursement, it's their normal reimbursement like they always would.
So they're kind of eating the cost, but it's mandated by the federal government.
Right. So it's complicated.
So I was halfway
They don't
right.
like that either. Yeah.
And halfway wrong. Well, that covers 340B in depth.
Yeah.
You guys have anything to add?
Do we offer any deliveries for medications?
Yes, we do. So all of our pharmacies.
Wow, that wasn't a premeditated question or anything.
No, it wasn't up here the whole time.
No.
I was waiting to ask.
No. All of our pharmacies do currently, except for Chillicothe. Once they get rolling more, then we do plan on having delivery there. For the St. Joe locations, it's anywhere in St. Joe city limits. Gower is a 15-mile radius, and then Hamilton is about a 10 to 15-mile radius too. They do kind of limited delivery at Hamilton, just because they don't have a specific delivery driver. But Chillicothe, we plan on getting it going too once they get
Yeah.
rolling a little more.
And it's free delivery.
Yes, it's free.
Oh, wow. See? It could
That's
just be
legit.
dropped off at your doorstep. Well,
right.
you probably have to be home, but
yeah, we don't want to.
yeah, medication's not just floating
Yeah.
about.
This isn't Amazon, honey.
Yeah.
And we can mail medications too. I
See?
know for people like in King City and different places
Mm-hmm.
that they're not always in town, the mailing route is convenient too.
Awesome. Well, it sounds like Northwest Health Pharmacy has it covered. Has
try.
everyone covered?
I love how Tanner's a sitting billboard right now.
Yeah, it's great.
Yeah. You have to sign for the medication, Tanner.
Yes, yeah, you have to sign. But yeah, it's convenient.
It
That's
is
right.
convenient.
Yeah.
I did not know that we did mailing that much.
Yeah, we do generally have the patient pay the postage just because it varies so much.
Yeah.
But that's an option, and we don't mail refrigerated medications, of course, just because
Right.
we can't, guarantee that it was kept at range.
Right.
So, but
But yeah, we do have the local delivery, and it's free for pretty much all the pharmacies except Chillicothe, but it will be available at some point. Well, that's great.
That's fantastic.
Yeah.
Yes.
So 340B, free delivery. I mean, you can't.
Yeah, you can't beat it.
right.
Mm-mm.
And
We had
personal service. They try to know their patients. They try
Yeah.
to, keep track of when things are going to be due, or they know their names when they walk in. That's
I was going to
huge
say
for
every time
people.
I visit one of our pharmacies, especially here in North End, every time I'm in there, there's at least somebody that walks in and the staff's calling them by their first name and,
Right.
you know, how you doing today? How's your dog? You know, and they got dog treats.
Yeah. And I mean, I know that's harder for the corporate ones just because they see so many people and it's such a turnover, but, you know, that is part of what makes us, I think, stand out too.
Yeah,
is that
absolutely.
we really try to know our patients. We don't have as big of a patient load, so we can kind of develop those more personal relationships.
And the other nice thing, some people might not know if they've never been in one of our facilities, but the family medicine pharmacy is inside of the lobby of the clinic here in this building where we're filming, and Tyson manages the clinic and you manage the pharmacy, and then we have also the pharmacist over there that manages too, but that they're in the same waiting room.
Right.
And that's really convenient because
One-stop shop.
Yeah, one-stop shop, because when the patient goes back for the appointment and if they need to get a medication filled, they can send it to the pharmacy while they're here. And oftentimes it's ready in like 15, 20 minutes, you know, as long as it's not a big order or anything.
Right.
And they can wait a little extra longer and get
And
their
they-
medication without having to go home and then get
Come
back out.
Yeah, I
Right.
get it.
Or go home and have it delivered.
Yeah, you could do that as well.
That's right.
So that's convenient. And North End's a similar setup. They have two separate entrances, but they're in the same building next to each other.
Right.
And that's very convenient too. Why not wait an extra 10, 15 minutes if they can fill a medication for you before you leave?
Right.
You know, back in the day before I worked here, anytime I had to get medicine, it's like you go to the doctor, they give you the antibiotic or whatever, and then they ask you which pharmacy you want it filled at.
Then you wait 7 hours.
Then you wait all day long. You call 2 or 3 times.
Right.
And sometimes, a couple times, you wait till the next day, and it's like, I really need to start this because I'm sick.
Yep.
Right.
Yeah.
But here, ever since I've been getting services here, I know that I'm going to get all of my stuff before I go home.
Mine have even been like done before my appointment's over.
Yeah.
Yeah.
Yeah, they really try to watch people that they know are waiting. And, you know, if they didn't send all of them, then it's nice when you have a Northwest provider because it's a little easier to get a hold of them and kind of collaborate that way. So that's another benefit.
Yeah, so it's very convenient and local services. You can't beat local.
Correct.
With anything most of the time.
Right.
So I have a fun question, I guess, and you don't have to answer it if you can't think of anything. But because you've been a pharmacist for how long?
Since 2010.
2010.
So a while.
13 years.
Wow.
Don't make me feel old.
No, you don't look old,
Oh,
so that's
thanks,
great.
Tanner.
You're welcome.
What's the craziest situation you ever had? Anything.
Man. I mean, it
Without
had to
violating
be,
HIPAA or anything.
Yeah. We had someone come in at a previous job, not this one, but you know, there's a lot of mental health struggles, and I'm assuming this was part of it. There was a team member that didn't work in the pharmacy, but worked out in the over-the-counter area. He was convinced that somebody was, you know, giving her drugs from the pharmacy, giving her, you know, it was pretty bad. We had someone come in and, you know, just basically kind of threaten all of us and was waiting in the parking lot, and we had to try to get that calmed down. And I mean, police came, and I think that was maybe the craziest. There were other times when you'd have, you know, patients with blood sugar issues, you'd have to call the ambulance and make sure they were okay and get them sat down and things like that.
Like people that were waiting in the lobby or
out
for their medication?
Yeah, or sometimes they weren't even waiting for medications, but you'd see somebody come along and we had a bench there in front of the pharmacy.
Oh, yeah.
And so they would sit and you would look at them and they did not look okay. So you'd have to go out there and kind of
Do they give you those trainings?
No, not at all.
Oh.
I was just curious. I mean,
Yeah.
you know, pharmacists have to go through a lot of schooling. I
Right.
didn't know.
It's like, well, you know, we know how to check their blood sugar. So you look at that, and then if it's low, you try to either get them to drink something, or we had glucose tablets or things like that. But if it wasn't their blood sugar, of course, you're calling the ambulance usually either way to have them checked out. But, you know, that initial care, you got to take care of them and do something while they're there. So,
Yeah.
you know, I have many other Walmart stories that I probably can't share. So
That's okay.
yeah, I think maybe we'll stick with those.
What are what's the biggest stressors of being a pharmacist? Like, because I also want to talk about recruiting pharmacists a little bit and going into that field really quick. But before we do that, what are like the biggest challenges, I guess, not stressors, but...
So burnout, I think, in any profession is getting kind of hard now. With pharmacy, it seems like it's been way more, especially after COVID. You know, a lot of people could work at home. They could do things by telehealth or, you know, be at home and do things. Pharmacy was never able to do that.
Nope.
We had to be there, work with their medications, had to be there for the patients.
Yeah, you guys both lived that.
Yeah,
Yeah.
I worked in a pharmacy during COVID, and I saw most people who got to stay at home. And I mean, unfortunately, some people lost their jobs, but a lot of people got to work from home and still make that money. Well, I still had to go into a hospital and work the pharmacy and,
Right.
you know, deliver the drugs.
Right. And it almost made it harder because they were definitely there. And there was times, you know, we had to close off our lobby. Nobody could come in the building. So then they're running medications out to cars.
I forgot about that.
Yeah. So payments, running cards back and forth, running the medications, figuring out who the patient was. It was a lot. So I
Sounds
think...
like a nightmare.
Yeah. And of course, they had to still show up every day while there was an empty building.
It was. I remember when the pandemic hit, and, you know, I work in marketing, so I don't do patient care. But I do remember because we got sent to work from home for probably 6 months straight. But there were a few times I would come into the office to grab something or, you know, a battery for a camera or whatever. And your staff was the only ones here.
Right. I mean, and I have to commend my staff. That is one thing that I want to get across is probably the best thing about working here is my staff. They are an amazing group. I mean, they try their hardest. When I have something that we have to do, we try to collaborate and talk about things, but I have to commend them on their efforts through that whole thing and all the time.
Yeah.
I mean, I really have a great staff, and that's hard to find anymore. So I want to definitely commend them. But just back to the burnout, I think that was probably the worst era of it.
Yeah.
But now, of course, you know, over the years, there's been, parameters that you have to meet. More and more has been put on pharmacists. You're not just checking the scripts, you're answering the phones. You have to counsel the patients, give immunizations. I know some of the retail pharmacies are having them check blood sugar, check cholesterol, do testing now for strep.
So it's almost like you're a medical doctor.
Yeah. And we haven't really been given any more for that. Training has been kind of scarce, to be quite honest. They just expect you to do it for no more. So all the things piled on, and then you're told, you know, scripts are in the red and you didn't get it done in 15 minutes. It's just burned a lot of people out on retail. So that has been really hard for people.
Do you think the number of students going into pharmacy is dropping?
I think it is now. I think it is now. When I was in school, between 2005 and 2010, we started having a bunch of satellite programs. We were actually the first class at UMKC that had a satellite program in Columbia. So that was kind of hard to deal with, the technical things. But they started having these satellite programs pop up everywhere. Which the university gets more money, of course, with more students, but it kind of caused an overage of pharmacists. And now I think we're starting to turn the corner of not so many people went in, and especially the burnout and after COVID and things, that not as many people are going into the profession of pharmacy.
Do you know any pharmacists that left because of the pandemic, left the profession?
Yeah, I know one that I worked with at Walmart that actually, it was before the pandemic, but he was just burnt out and done.
Yeah.
He completely went, I think it was geology. I mean, he changed courses completely and just decided this wasn't for me. I mean, I know a lot of people that are really trying to get out of the retail realm. So it's just, you know, some of the parameters and things. And our board of pharmacy did, thank goodness, put a few things in place where they can't have such strict parameters. But there's not really any oversight on it, unfortunately.
Yeah.
So while they put those measures in place, I think more needs done to make sure that the policies are being followed. But that's one thing when I came here and opened these pharmacies, I tried to make it to where if we were going to start a new program, I talk to the pharmacist first. I always collaborate with my staff first and talk to them to see how it's going to affect them, because it's not me in there doing it every day. It's them. So I really try to talk with them. I try to help them out when they're down on people. When they have, for example, family medicine pharmacy has been out a few techs, you just need to go help them.
Yeah.
So do what you can do to help them out so it's not as stressful, because I didn't want to create that environment if I could help it. So that was my big thing here, was really just collaborate with staff and try to see where their needs are, rather than harping at them about their numbers, harping at them about not getting things done, because then nobody's happy. Nobody's productive.
Yep.
So.
Yeah, pharmacist, it always seems like they're the underdogs.
Yeah, I have to agree. Yeah.
Like, I mean, especially in a big network like we have, because we have medical, behavioral health, and dental on top of our pharmacies. But yeah, pharmacy is like a very steady, consistent thing, but we don't ever really talk about it because it's just
keeps
there
running.
and always running. It's like a machine. I always say it's just a big machine.
Yeah, and that's the other struggle with pharmacy is, if somebody's out, if somebody's sick, if there's PTO, you have to be open. So you have to find coverage. You can't just block patient schedules or say they're not going to be here that day. You can, but it really interrupts patients.
Yeah.
I mean, you don't know who's coming in to pick up their medications that day.
Exactly.
So you can't call them ahead of time.
Yeah, because, we manage our website requests, and oftentimes people send stuff through and it's medication related, especially going into the weekend. I have to have my medications today.
Right.
And so it's very important. And like I said earlier, I think that's the thing that costs the most usually for people, and they have to have it.
Right.
And so
it can be a big area of stress for patients for sure.
Yeah.
Between the cost, between making sure they have it, refills, they run out. You have to talk to the physician again. And I mean, they're not the only one waiting. So physicians have a long line of things to do.
Yeah.
I think it's a big cause of stress in our society sometimes.
And it's not that we're saying that like medical doctors and stuff don't have the same pressure. It's just the pharmacy doesn't get talked about as much.
Right.
Like,
yeah. Every healthcare profession went
medical
through a lot.
doctors are much more popular in a sense, I guess, than a pharmacist, but they're both equally important because the medical doctor can't
They can't
fill
fill
the
a prescription. Well,
Right.
actually,
they can write it, but they can't fill it.
Yeah.
All right. That's why collaboration is so important.
Well,
You
I think
really try to work together.
as consumers, our lives are so busy. We wait till the very last minute, for a refill, and then they expect magic to happen, and I think that's hard I'm guilty of it too, waiting.
Oh, same.
Right. And
So,
everybody is.
Yeah. You want the pharmacist to be the magician and pop that out within 15 minutes.
Right.
Well, that's not how life works.
Right. And we're very
So they have a
accessible.
lot of
I mean,
pressure.
you can walk up to your pharmacy counter and talk to the pharmacist and,
That's another
basically
thing I
call
liked
'em.
here. On the checkout, what's that called? Kiosk? Is that even
Oh.
the right word?
Yeah.
It says, "Do you need counseling?"
Yeah.
Well, I need counseling, but no,
Counseling
literally,
about
I
your
was like,
medicine.
"What?" I thought that was awesome because that's like the pharmacy I went to before never had anything like that.
Really? Yeah.
So I did start a new medication, and I said, "Yeah, I do need a little guidance." And the
Yeah.
pharmacist came right up,
Cool.
told me exactly what to do, gave me some tips, and I was like, "Okay."
Yeah. And that's.
I was appreciative of that. I know I
Mhm.
work here, but I mean that's perfect that we have that option for
Yeah.
patients as well.
And I feel like hopefully our pharmacies, like I said, since they're not as busy as corporate, I mean, a lot of times the patients see big lines. They've been waiting. The pharmacist is stressed out. Like they don't want to ask a question. They don't want to take their time because they feel bad about it. But that should never be. Like if patients have a question, they need to ask it and feel like they can ask.
Yeah.
And I feel like here ours, we're approachable and they answer whatever questions they have and have, a little more time. Granted, we have smaller staff than corporate, so it does get stressful sometimes. But I feel like patients sometimes more so feel like they can ask, especially since we develop those relationships.
Yeah.
So I'm, from what I see, it works.
Yeah, absolutely. And while those are the pressures of being a pharmacist, are there any perks of being a pharmacist?
Yeah, I mean, of course, patients, if you ask any pharmacist, most of the time will be, it's rewarding. when you can actually counsel, talk to them about their medications. You know, you don't want to feel like a robot checking things all day. So when you can get the patient interaction and talk to them and kind of find out what's been going on in their life or things they can help with, I think that's really rewarding. So most pharmacists would say the patients. Again, I more so deal with the staff. So for me, having an amazing staff makes my job 100 times easier and more enjoyable. So of course, you know, perks like that are great.
And I know too, like here specifically at Northwest Health, our hours are probably a little better.
Oh yeah,
than
so
other pharmacies.
Yeah, no weekends here is amazing. Like you don't get that at most pharmacies whatsoever, and no evenings. I mean,
Do you have to be on call at other places? Like,
sometimes you do. It depends. You know, a lot of long-term care pharmacies need somebody on call. But here we don't have that. We don't have evenings and we don't have weekends. And you get holidays. I mean, most pharmacies, a lot of them now are not closing for most holidays anymore.
Really?
So you have to do a rotation.
Because there's that big of a need for...
Yeah, they just want to be open. So, and the fact of just no weekends, it seemed like always on my weekend was when, you know, my kids had something of a sporting event or something that was planned. And it was hard to find somebody to switch because everybody, you know, has already worked their weekend. So that's a huge benefit here. I mean, the hours being off by 5:30, that's amazing too. Mm-hmm. You have your evening, you can go home and have dinner and make dinner for your family. And so that's amazing. And like I said, the holidays and then an hour lunch. I mean, other places you are supposed to get a half hour or they may give it to you, but you're lucky if you get it. I mean, you hurry up, scarf your food, and try to get back because it's just busy.
Too busy, yeah.
Here we completely close down for lunch for an hour. So it just kind of, and I really appreciate that and champion that because you need a mental break. You can't just keep going.
You need to unplug and like not think about it for an hour.
Right. So us closing for lunch is huge every day. And then, like I said, we're Monday through Friday, 8:30 to 5:30. So that's really great hours in pharmacy and really hard to find.
Yeah. Mm-hmm. Yeah, because, I mean, these pharmacists and techs are going over hundreds of scripts a day. Mm-hmm. And you get one thing wrong, that, I mean, that's like crucial.
I mean, in my previous job, I was most of the time doing 200 scripts before noon by myself.
Jesus.
Wow.
It's a lot.
That's ridiculous.
It's a lot.
Yeah. And yeah, I mean, I couldn't imagine because ultimately you're the last one checking these things before somebody goes and swallows them.
Right.
You know,
Yeah, it can have serious consequences if you're not mentally clear.
Yeah. And we do have a pharmacist position open.
Yes, we do. Now. At our North End Pharmacy. So it's located in St. Joe, off the avenue. And it's Monday through Friday, 8:30 to 5:30 like the other locations. No weekends, no nights, and they close for an hour lunch as well. So
brand new facility.
Yeah, it's a really nice pharmacy. And like I said, we're right there in the same building as the North End Clinic. So get to know a lot of those patients and help them out.
That probably helps, too, for the pharmacist to have the nurse practitioner on the other side if there was an emergency.
Right.
You know, because oftentimes those other pharmacies out there, they don't have a medical professional on
the
site. So
you're definitely calling the ambulance.
So, yeah, like you said, the collaboration is key and the work-life balance. And that pharmacy at North End has a brand new drive-through. Everything's brand new. It's only been open a year and a half at that location. How many techs do they have?
They have 2 and a part-time. So 2 full-time and 1 part-time.
Yeah, and I'm assuming that's plenty of help for...
Yeah, it is. I mean, it works well. And that was the other thing I try to really watch is if a place is getting really stressed out and it's just not doable, then we need to look at adding. I mean, you don't want it to make it to where you don't want to come in every day.
Right.
And you're stressed out and behind because that's when more mistakes happen. So I do try to definitely watch when we need to increase on help.
Yeah. So yeah, if you're a pharmacist or you know a pharmacist, apply.
Yes.
We can put the link and stuff on the podcast and wherever you're watching this, but it's nwhealth-services.org/careers, and you can click apply and I'll
be speaking with you soon.
Yeah, and then Miranda would be the one interviewing you. So don't give away all your secrets.
All right, I won't.
Or just give them away so you
Yeah.
can find somebody.
Yeah, I was gonna say. Well, we did a pretty good job. PTO is pretty good here too. So
Yeah,
The
I was gonna
benefits are
say,
amazing.
Yeah,
Yeah.
the benefits here are really good.
They
like
are.
that is one thing that keeps me here too. Especially having young kids at home.
right.
Yeah.
Because our PTO, is it different for pharmacists or is it the same?
I think it's the same because
Yeah, I think
talked
it's-
to HR about that.
Yeah, it's
Okay.
the same.
So they accrue 4.5 weeks a year.
Yeah,
And then you can max out at 6 weeks.
I think so. Yeah, and it rolls over. A certain amount of it rolls
But
over.
I mean, it accrues pretty quick. I think it's around a day per pay period or something.
Yeah, it's
of PTO.
really close, 7 point something.
Mm-hmm.
I mean, it's really good. Other places you go, you're maybe getting a week a year.
And then
2 weeks if you're lucky.
if you stay for 5 years or 3 years, I,
think it's
can't
5
remember.
years.
It builds faster because I've hit my 5-year mark.
Okay.
And it seems way faster.
And you need to take some PTO
Yeah.
yeah,
because you're
I think I'm
maxed out.
You got like
Oh.
6,000 hours.
Well, 6 weeks.
Oh my
yeah.
goodness.
I know. Mine's scheduled for next week.
But that's the thing.
I'm
Once it gets built up, though, like you can take a week off, and then
You're back to where you were.
2 or 3 months, you got your week back.
Yeah.
And I don't take
not
a
a
week
bad
off
thing.
every quarter, so
You never know when
you
things happen.
Mm-hmm.
Yeah, and we haven't really talked about this yet, but I know you're kind of making some staff changes a little bit in the pharmacy world, and I won't give too much information, maybe just for the sake of confidentiality, but eventually, and just correct me if I'm wrong, it'll be to a point where if a pharmacist had an emergency and needed to leave during the day, you have people that could step in.
Yeah, so we're hoping to get soon, once we get the North End position filled, kind of a float pharmacist. And then part of the time she'll be helping me with
Yeah.
projects and
That'll be
things.
good.
That way we can expand things because
And
there's
you're
all kinds
a
of
pharmacist
services.
too, because I know you've
Right.
stepped in quite a bit
Right.
and helped.
So it'll be nice to have someone that's basically covering all of the PTO that knows how to use the system.
Yeah,
they know
that's-
how
Right.
to run it. They know the patients. They know the setting. So that'll be phenomenal. And then helping me with a few projects, which I've had kind of in the background to help expand some services and things,
Nice.
will be great.
And you have PRN pharmacist.
We do. Yeah, we have a couple of those that we've been running on for some time. But with as much PTO as we get,
Yeah.
it was starting to get hard to cover 5 locations. So I think this position will be really helpful.
Yeah.
Awesome.
So, yeah, if you're interested in applying, it is a full-time position at our North End pharmacy location on St. Joe Avenue. They always have a good time over there. Every time I go over there, they're
Yeah, they're a
chipper.
good crew. Like I said, all of my locations are great. I can't say
Kendra
enough.
and is it Gracie?
And Denise is the new one.
Denise.
so-
Yeah,
Yes.
I think I met her in passing
Yeah.
a couple weeks ago.
Yeah, they're a good group.
And if you apply and join, Tanner and I will bring you lunch.
Oh,
Oh,
There
wow.
you go. I'm going to apply.
that's weird because I applied and got a job and never got lunch.
oh.
Well,
So did I.
yeah.
Yeah, what?
Pharmacists are
You
very
get it
important.
tomorrow, though, right?
Okay.
Yeah, tomorrow this is going to come out
Yeah,
after.
tomorrow we're
but-
having a lunch,
Yeah,
Tyson.
well, I went on the 3rd because that's what the poster said.
Well, so how was
Listen.
the concert yesterday?
we fixed
It was
it.
very quiet.
I didn't even notice that.
I always like
just
to
knew
give him
Friday.
crap.
Well, we the first flyer we made, I had a different date in my mind, so it was
Oh,
wrong.
Yeah, well, that happens.
And
people-
Tyson found the one flyer that we didn't take off the wall.
I was
Yeah.
so excited when I
'Cause
found it too.
I had fixed all of them as soon as I realized it, except one apparently. Well, is there anything else you guys want to say about pharmacy world that we didn't cover?
I learned a lot.
Yeah,
For sure.
I knew we were going to.
Basically, I mean, in orientation, like when I do that presentation, I try to just get across to people. My main point is if you hear of somebody struggling to afford their medications, have them call one of our locations. You know, we might not always be able to do something, but there's a chance that we could.
Yeah.
So there's been a lot of people that we've been able to help. So if you're hearing of somebody or know of somebody struggling to pay for medications, have them just get a hold of one of our pharmacies and talk to the staff.
Yeah, and there's a list of all of our locations on our website and phone numbers and addresses, and you can also just Google it and it should pop up. But yeah, reach out to a pharmacy.
Thank you, everyone, for watching the pod presented by Northwest Health. Thank you, Miranda, for being our special
Yeah.
guest.
Yes.
Thanks for
Yes.
having me.
And all your
Appreciate
hard
it.
work that you do.
I'm the only one
and
that clapped. Okay.
Thank you for all your hard work that you do for Northwest and
Yeah,
our
we
patients.
appreciate it for sure.
Yes.
All right, thank you.